Assalamualaikum everyone, my name is Dr. Dileep Kumar. I am lecturer at the Department of Physical Therapy and Rehabilitation Sciences, Indus University. As we have already launched the anatomical tutorial series and we have covered the almost bones of the upper extremity, now we are moving toward the forearm. So in last recording we have discussed about the lateral bone of the forearm, which is the radius. Now we are targeting the ulnar bone, which is the medial bone of the forearm. So let me introduce you first the bony landmarks, the general features and side determinations of the ulnar bone, then we will target the structures which are attached on it. Okay, so let me show you कि let's suppose अगर कोई भी बोन ड्यूरिंग द क्लिनिकल वाइवा और साइड डिटर्मिनेशन से मुराद की जब आपको you have to determine the side of the bone whether it is right or left, simply is the साइड डिटर्मिनेशन. तो साइड डिटर्मिनेशन मिसाल के तौर पे कोई भी बोन आपके पास राइट या लेफ्ट हो आपको नहीं पता, सो हाउ यू विल डिटरमाइन दैट वेदर इट बिलोंग्स टू ईदर राइट साइड और लेफ्ट साइड. ओके, सो इफ दिस इज द अल्ना बोन you have to accommodate it and you have to define it, determine it whether it is right or left. Okay, तो अल्ना बोन को जैसे ही हम देखेंगे या जैसे ही ग्रिप करेंगे तो इसमें कुछ ऐसे फीचर्स होते हैं जो कि लेट्स सपोज इफ यू टॉक अबाउट दिस फीचर, this is called the radial notch of ulna that will articulate with the head of radius to form the superior radial joint. First point. Secondly, ये जो trochlear notch है, it is quite open medially. तो if I place it, दो तीन चीजें हैं upper end में, lower end में styloid process which should be medially. So if I place it in my left side, if I am placing it, the styloid process is facing medially. This is my medial side, so this is quite correct. And if we see the radial notch is laterally because it will articulate with the head of radius to form your superior radioulnar joint. So let me show you how. This is the left radius. Okay, if I articulate or conjoin both of them, this is somehow, okay, this is somehow joint is formed. So this is the superior radioulnar joint and here from the inferior radioulnar joint. So if you watch the superior radioulnar joint, this is the head of radius, how it articulate with the radial notch, and the styloid process of radius should be laterally while the styloid process of ulna should be medially. Okay, तो मतलब ये जो है वो आपकी लेफ्ट अल्ना बोन है. ठीक है, सो अल्ना बोन इज आल्सो डिवाइडेड इनटू द थ्री पार्ट्स. द अपर एंड, if I grasp it from a left hand, and this is the lower end and remaining part would be the shaft, just like the humerus, just like the radius also. So this is your lower end in which the head of radius, head of the ulna and styloid process comes. This is the lower end and this is the upper end, remaining would be the shaft of the ulna. तो इसी तरह इसमें हम ये है उसका साइड डिटर्मिनेशन कि आपने दो चीज़ों को देखना होता है. एक styloid process should be medially. If I place it on this side, firstly this is quite wrong because the radial notch is facing medially and it must be laterally, while you see the styloid process is laterally, radius toward the radius side, it should be medially. So here some side determination we can focus during the clinical viva or during the recognition perspective. Okay, अब हम आ जाते हैं जनरल फीचर्स के ऊपर कि हमने उनको तीन हिस्सों में तो डिवाइड कर लिया अल्ना बोन को कि लेकिन जो तीन पार्ट्स हैं अपर, लोअर एंड शाफ्ट, उनमें भी जो है वो मजीद बोनी लैंडमार्क्स हैं, उनको हम देखेंगे. ओके, सो इफ यू टॉक अबाउट, लेट मी शो यू ऑन स्केलेटल आल्सो. इफ आई शो यू ऑन दिस इज योर राइट side, so this is your right radius, this is the right radius and this is the right ulna. Okay, this is the ulna bone. तो यहाँ तक जो पार्ट आपका होगा, दिस इज द अपर एंड, यहाँ तक अल्नर ट्यूबरकल तक, जो कि हम डिस्कस करेंगे. दिस इज द होल shaft and lastly you have a head of the ulna which is the lower end. So if I place my two finger, this is the lower end, this hole is the shaft of the ulna and this my upper two fingers, this area is basically the upper end. Okay, if you see the upper end, there are the special four landmarks that you need to define it or need to focus. The first one you can see is the upper end, upper part. This is the olecranon process. This is the olecranon process and this is the coronoid process. Okay, this is how somehow the C shape is, if you see. So the upper part is the olecranon and the lower part is the coronoid. Okay, so this is the olecranon and this is the coronoid and in between them there is a notch which is called the trochlear, trochlear notch, okay, which articulate to form the elbow, okay, elbow joint. This is the Olcanon process. If you see on the Olcanon process, it has superior surface, superior view, it has superior surface which is quite rough, it has lateral surface, it has, if I show you on this, it has the superior surface, it has the lateral one, okay, and it has the medial surface. So, Olcanon has 5 surfaces basically. The first of them is the superior, you have a lateral surface, it has medial surface, the one is the anterior surface which forms the upper part of the trochlear notch, and then finally it has the posterior surface. If you see the posterior surface, it is quite triangular in shape, it forms the apex, it round way comes and it goes to the downward in order to form or articulate with the posterior border or the posterior surface. So there is the apex basically where a V-shaped structure passes downward, okay. So it has 5 surfaces on Olcanon process. Then you come on the coronite. Coronite, it also has the anterior surface which forms the remaining part of the trochlear notch, or which forms the lower part of the trochlear notch. It has anterior surface, this one is the superior and this one is the anterior. If you see the anterior surface, it is quite triangular in shape and some sort of the rough or having tubercle. तो एंटीरियर सरफेस में अगर आप देखेंगे तो ये ट्रायंगुलर इन शेप तो है, लेकिन नीचे डाउनवर्ड वो एक ट्यूबरकल टाइप चीज बना रहा है, और ये अल्ना पे है तो इसको अल्ना ट्यूबरकल कहा जाएगा या अल्ना ट्यूबरोसिटी, ओके. सो दिस इज द एंटीरियर सरफेस एंड द सुपीरियर, दिस मस्ट बी द if you see the medial surface, and when you focus on the lateral surface, it has a notch. This is called the radial notch because it articulate with the head of radius. This articulate with the head of radius to form the superior or proximal radioulnar joint. Just below this radial notch there is depression. यहाँ पे एक depression है इस radial notch के बिल्कुल नीचे. This depression is basically to accommodate the radial tuberosity or the bicep tuberosity on the radius to during the movements of the forearm. Let me show you. This is the head of radius and this is the bicipital or deltoid tuberosity, okay. So it articulates with the radial notch, while this depression is giving accommodation to the radial to the bicipital tuberosity during different movements of the forearm, okay. So laterally you have a radial notch and the depression to accommodate the bicipital tuberosity, okay. तो coronite के भी 4 surfaces हैं, the superior one, the anterior one, the medial one and the laterally you have a radial notch. So 3 से 4 चीजें जो कि Olcanon, coronoid, आपको चीजें ट्यूबरकल एंड रेडियल नोच, ये 3 से 4 चीजें जो है आपको अपर एंड में देखने को मिलेंगी, जिसके बिहाफ पे आप उसको कैटेगराइज कर सकते हो कि ये राइट साइड की अल्ना बोन है या लेफ्ट साइड की. अपर एंड में एक और स्ट्रक्चर भी थी विच वी नीड टू डिस्कस. जैसे ये रेडियल नोच है, रेडियल नोच इज बेसिकली लिमिटाइज्ड पोस्टीरियरली बाय अनदर crest or ridge. This crest or ridge is named as the supinator because of the attachment of the supinator muscle. उसको भी हम डिस्कस करेंगे. तो अपर एंड में आपको ये 4-5 चीजें देखने को मिलेगी. Now moving toward the shaft of the ulna. If you see the shaft has the 3 borders and 3 surfaces like the radius bone, okay. If you see from the anterior perspective, the number 1 you have an anterior, there are the 3 borders. So you have an anterior border. If I mark with the pencil, the all way anterior border is coming from this tubercle, this V-shaped tubercle we have discussed already, the ulnar tubercle or ulnar tuberosity. यहाँ से ulnar tuberosity से ये border start हो रहा है and all way going downward toward the styloid process. This is the styloid process which we will discuss in the lower end, okay. तो यहाँ से ये ulnar tuberosity से ये border which is very sharp is getting start and terminates at the styloid process of ulna, okay. Number 1 you have anterior border. Then just look at the other aspect. This sharp border which is quite sharpful, which is called the intraossei border because of the attachment of the intraossei membrane. अब यहाँ ये कहाँ से extend करता है और कहाँ से ये start होता है. If you see, this is the supinator crest जो कि upper end का part है. supinator crest से ये बिल्कुल start हो रहा है and it is going downward to this is the head of the ulna. Lateral head of the या कह लें कि lateral side of the head of the ulna, जो head of ulna है उसके बिल्कुल laterally, the long way starting from the supinator crest, and it goes downward and terminate at the lateral head of the lateral side of the head of the ulna. So you have an anterior border, you have the introstia border, and finally you have a posterior border. पोस्टीरियर बॉर्डर अपर एंड में हमने एक वर्ड यूज किया था एपेक्स का. तो एपेक्स कहाँ पे होता है कि जो पोस्टीरियर पार्ट ऑफ द ओलिकनोन है, जहां पे वो वाइंड अप करता है या जहां पे वो ओलिकनोन प्रोसेस जो टर्मिनेट होता है, वहां पे एक वी शेप एपेक्स टाइप स्ट्रक्चर बन जाती है. ठीक है, यहां से एग्जैक्टली एपेक्स से जो है वो पोस्टीरियर बॉर्डर स्टार्ट होता है. इफ यू कैन सी विच इज वेरी क्वाइट थिक, ये यहां से स्टार्ट होता है और कहां पे टर्मिनेट होता है, बेस ऑफ द स्टाइलॉइड. दिस इज अ स्टाइलॉइड प्रोसेस, इसके बिल्कुल बेस पे जो है जाके टर्मिनेट होता है. तो यू हैव अ 3 बॉर्डर्स, यू हैव अ एंटीरियर, you have an introsci, and finally you have a posterior border. Now if we talk about the surfaces, जो anterior surface है, you also have a 3 surfaces, you have a anterior, medial and posterior. Okay, so now we are going to discuss the anterior surface and the firstly the anterior surface. The anterior surface is between, this is the anterior border and this is the introsci border. तो anterior surface in anterior border और introsci border के बीच का जो भी surface area है उसको हम anterior surface कहेंगे. Got it? जो anterior border है और आपका introsci border उसके बीच का जो भी surface area है वो anterior surface कहलाएगा. अब ये आपका laterally है because it will articulate with the radius, और ये आपका medially है, तो ये आपका हो गया anterior surface. If you talk about the medial surface, this is the anterior border and this is the posterior border. In between them, whole this surface area is your medial surface. Okay, the between the anterior border and the posterior border. Now talk about the lastly the lateral surface. If you talk about the lateral surface or posterior surface, कुछ बुक्स में इसको posterior surface भी कहा जाता है. Okay, now let's talk about the posterior surface. The last posterior surface is between, this is the posterior border and this is the introsci border. So between the posterior border and introsci border, all the surface area that it comes under the posterior surface. तो 3 surfaces, 3 borders, ये हो गई shaft. Now we are moving toward the lower end. If you focus on the if I show you on the lower end में आपको सिर्फ 2 स्ट्रक्चर देखने को मिलेंगे. Firstly a small head which has quite 290 degree what we can say the circumference. सिर्फ लोअर एंड में आपको 2 ही चीजें मिलेंगी. यू हैव अ हेड ऑफ द अल्ना जो कि एक छोटा सा हेड टाइप है, ये अल्ना का पार्ट है, एंड देन यू विल सी क्वाइट अ प्रोजेक्शन टाइप स्ट्रक्चर व्हिच यू कैन सी दिस टाइप. This is a styloid process of ulna, and we also have a styloid process of radius, okay, which is quite larger. ये एक छोटा सा styloid projection है. okay, तो 2 चीजें आपको, head of the ulna and you have a styloid, and between them there is a groove. If you see the between them is there is a groove between the head of the ulna and the styloid process of ulna. There is a groove for the tendon of extensor carpi ulnaris. Okay, and what is the clinical application of this head? The ulnar artery and ulnar nerve, they lie anterior or against this head of radius. So where the some sort of we feel some sort of the tingling or sensation, they come under the whenever this part is pinched. Okay, this was all about the bony features. Now let me show you on the skeletal a little bit demonstration. So if you focus on it, okay, this is your right ulna if you see, and this part is the upper, and you have a, and this is the lower end. So all you can see on superior aspect in upper end, you have a tubercle. This tubercle is the what we can say the ulnar tubercle or ulnar tuberosity. This is your anterior border. All you can see the introsci border. Introsci border is quite sharp, and then you have an anterior border. Anterior border यहाँ से start हो रहा है, anterior border ये अल्नर ट्यूबरकल से स्टार्ट होके, अल्नर ट्यूबरोसिटी से स्टार्ट होके ऑल वे गोइंग डाउन टुवर्ड द स्टाइलॉइड प्रोसेस. दिस इज द एंटीरियर बॉर्डर एंड दिस इज द इंट्रोशा बॉर्डर, एंड बिटवीन देम इज द एंटीरियर सरफेस. इफ यू टॉक अबाउट द पोस्टीरियरली, दिस पोस्टीरियर बॉर्डर, दिस इज द एपेक्स. ये आपका एपेक्स है, जस्ट जहाँ पे जो आपका ओलिकनोन प्रोसेस है वो खत्म हो रहा है. जैसे ही ओलिकनोन प्रोसेस खत्म हो रहा है, यहाँ पे ये एपेक्स है. ये एपेक्स से पोस्टीरियर बॉर्डर स्टार्ट होता है एंड देन गोज इट टू द बेस ऑफ द स्टाइलॉइड प्रोसेस. ओके, सो यू हैव अ एंटीरियर बॉर्डर, इंट्रोशा बॉर्डर, एंड यू हैव अ पोस्टीरियर बॉर्डर. इफ यू टॉक अबाउट द सर्फेसेस, you have an anterior surface between the introsci and between the anterior border. The whole surface area is the anterior surface. When you look at the medially, okay, the all way between the anterior and the posterior aspect, you have this surface. This is the medial surface, and when you talk about the posterior surface is all way between the posterior border and interosseous border. This whole surface area is the posterior surface. Okay. So if you see, this is the olecranon process, and it goes into the olecranon fossa during the elbow extension. Okay, and this trochlear, what we say, this is the trochlear notch of the ulna, which articulate with the trochlear process of the humerus, and which is a trochlear notch is the concave, and the trochlea is your trochlear process of the humerus is the convex, and how it articulate during the flexion and extension movement. Okay, and this is how this is the radial notch of the ulna, where the head of radius fit and the movements occurs, and just below it, just below the radial notch, you have a depression which accommodates the bicipital or radial tuberosity during different movement. This is your pronation, okay, and this is the supination. So if you see in different movements of the forearm, this gives place, or this gives basically a depression during the different movements of forearm. This depression just below the radial notch, and radial notch basically gives attachment, or give where the also the attachment of the annular ligament, but it gives place to the head of the radius during the different movement, and it forms basically the upper radioulnar joint or superior radioulnar joint. Okay, when you go downward, when you see the downward, you have a styloid process of ulna, and this is the head of the ulna. And head of the ulna, if you see, and the head of the ulna articulate with the inferiorly with the radius to form the inferior radioulnar joint. Keep in mind, this is not going to articulate with the carpal bone. The inferiorly ulna is only attached with the radius bone to form the inferior radioulnar joint, and this is the styloid process of ulna. These are the bony features of the ulna. Now we are moving toward the muscles.